Thank you for watching this presentation, which is important as it impinges on the future of research and medical practice, and consequently on the well-being of patients. David Whedon is one of the better known and internationally recognized dermatopathologists who has mentored many pathologists, and perhaps is most known for his tremendous work in producing what must be one of the most definitive books on the topic. However, he was also scrupulously ethical, and to paraphrase another famous book, could be regarded as a light unto dermatopathology. Medical ethics is not new, as this book from the early 1900s testifies. A detailed discussion of this topic is beyond the scope of this presentation. However, it does include honesty, objectivity, openness, and transparency. On a related topic, there is self-regulation. Unfortunately, self-regulation does not always work, as it depends on the honesty of the people involved. Recall that several decades ago, when the tobacco industry dishonestly reiterated that self-regulation was working and that that industry required no government interference or regulation. Cancel culture has now become common, where people with differing opinions will strive to ridicule, silence, and stop their opponents from expressing those views. We have all seen examples on social issues and climate change, and unfortunately this has now become part of dermatology and dermatopathology, as this case study will demonstrate. The case study involves 3 groups, one of whom you may not know. The Australasian College of Cutaneous Oncology was set up by a group of skin cancer specialists and is self-funded. It accepts no money or gifts from any institution, pharmaceutical company, government authority, or any other institution. Its funds come from teaching GPs skin cancer in courses and conferences. It has initiated research projects, including drug trials, and has contributed significantly to teaching innovation, including teaching dermatopathology of skin cancer to clinicians, which is now more widely practiced. The 2 other main players, the Melanoma Institute Australia and the Royal Australian College of General Practitioners, need no introduction. In 2018, the Journal of the Royal Australian College of GPs, or Racgp, the Australian Journal of General Practice, AJGP for short, commissioned the Australasian College of Cutaneous Oncology to write 2 papers on melanoma management. Specific requirements were given. The editor-in-chief, Professor Stephen Margolis, knew the main author and his views, as both had cooperated in the past. The papers were written, sent to independent colleagues for comments, and then submitted. The papers were sent by the journal for formal peer review, and according to correspondence, were well received. The peer reviewers suggested only some minor changes. These were done. The papers were accepted by Professor Margolis and published. Almost immediately, the Melanoma Institute Australia wrote to the journal claiming that there were factual errors in the papers and demanding retraction. About a dozen institute physicians were signatories. The top 3 were Professors John Thompson, Georgina Long, and Richard Scolyer, the last 2 being co-directors of the Institute. They based their retraction demand on 2 main complaints with some minor comments. The main objection was the paper's claim that current studies demonstrated that sentinel lymph node biopsy should no longer be considered necessary, as it did not alter prognosis. The Institute, however, maintained that it was life-saving. The editor-in-chief forwarded this Institute's letter to AJGP, the Australasian College of Cutaneous Oncology, stating that it was considerably too long to publish, and that the author refused to alter it to a format suitable for publication. The editor-in-chief thus commissioned a third paper from AJGP to respond to the Institute's concerns. AJGP submitted this manuscript, refuting the Institute contention point by point. The editor refused to publish this third paper. The summary of the issues gathered from the letter and from journalists were: 1, sentinel lymph node as therapy; 2, ultrasound versus sentinel lymph node biopsy; 3, other issues which are considered to be less relevant, but which I will be happy to discuss in any correspondence. The first issue was sentinel lymph node biopsy as therapy. AJGP wrote that there is no survival benefit from the procedure. This was based on published data, including the MSLT1 and MSLT2 studies, as well as an Australian government inquiry, which concluded that there was no survival benefit. This inquiry was prompted by an application to the Australian government for a Medicare benefit, which was rejected. The Melanoma Institute in Australia, despite the overwhelming evidence, including its own figures, maintained that this was life-saving. The second issue was that the paper said that the ultrasound could be a substitute for sentinel lymph node biopsy. It specifically mentioned the method, the then so-called Berlin method, ultrasound, which was a specialized technique then in use in Europe. The Melanoma Institute claimed that ultrasound misses 92% of metastases. The Melanoma Institute's claim that it misses 92% of metastases was based from Professor Thompson's own group. The problem, though, is that the Berlin ultrasound method and Thompson's ultrasound procedures were 75% different in technique. And to use the results of a substantially different method to discredit another method goes against all scientific reasoning. As opposed to Thompson's claim of 8% sensitivity, the Berlin method, which AJGP talked about in its early days, showed a sensitivity of 70 to 80%. This is a screenshot from the website of the Australian Journal of General Practice. It states, the journal is a signatory to COPE, the Committee on Publication Ethics, to which most journals subscribe. Signatories undertake to follow ethical guidelines. I would particularly like you to pay attention to the bottom of the screen, which states that the journal is a member of and subscribes to the principles of the Committee on Publication Ethics and adheres to the International Committee of Medical Journal Editors' recommendations. The guidelines state that a retraction process has to be open, the authors informed and involved at all stages, that the authors have a right to reply to accusations, and particularly important, reviews with personal attacks are not allowed. The retraction process, however, was done in secret without the authors being informed. In fact, the first time that the authors were made aware of the process was when they received a letter from the editor-in-chief that the papers had been retracted based on 3 independent reviews. Note that this included the sentence, "Your papers, as you acknowledge, have multiple errors," and also that the journal is bound by the standards and processes of both the journal and COPE. In fact, the authors never acknowledged any errors and had refuted the Institute assertions in a 3rd manuscript, so this was a false statement. The editor-in-chief refused to let the authors know the contents of the reviews. More importantly, he refused to state what the factual errors were. As can be seen, contrary to the claims of the editor-in-chief, the COPE guidelines were totally ignored. Subsequently, these libelous notices were placed, the papers themselves were taken offline, and the retraction notices were put up on search engines, including PubMed. Note that they also read, after consultation with our independent advisory panel, and we will get back to this, we have retracted the entire article. Immediately, Professor Thompson, Professor Aranda of the Cancer Council, and Professor Margolis went to the press to personally attack the authors. A journalist contacted the lead author and informed him that Professor Aranda of the Cancer Council had also written a letter demanding retractions. The ECHO authors had never been informed by the editor-in-chief of this letter. The media, including AusDoc, a news journal which is circulated to general practitioners, at least the author allowed the authors to present their point of view. The Melbourne Age and Sydney Morning Herald ran a particularly nasty campaign led by Professor Thompson to discredit the lead author with outrageous claims that he works from a cruise ship, and pending the claim that the author's statement on ultrasound is totally out of place because it misses 92% of cancers, which I have addressed already. What readers were never told was that the lead author was on a cruise ship at the time, working through a personal tragedy that had nothing to do with medicine. In the ABC Health Report, Dr. Norman Swan allowed Professor Thompson to repeat his libel of factual errors without question. Dr. Norman Swan refused the ECHO authors the right of reply despite 2 requests from them. The authors made multiple appeals to the Royal Australian College of General Practitioners. The then Racgp president, Dr. Harry Nespolon, stood by the journal, refusing to investigate the process of retraction. Tragically, Dr. Nespolon was dying of cancer, and near the time of his death, he wrote to the ECHO authors admitting that COPE guidelines were not followed. He wrote, "We acknowledge that withdrawing the articles is an extra step that goes beyond the COPE guidelines." He also sent the ECHO authors the 3 independent reviews, anonymized, that supposedly recommended retractions. Reports that the editor-in-chief did not want the authors to ever see. Regarding the 3 independent reviews, Professor Margolis had written, "The original papers plus your response to the letter of concern from Professor Thompson et al. Had been reviewed by both the editorial team and 3 independent reviewers. These external reviewers are well qualified to provide an independent and authoritative commentary across all aspects of the debate. The review notes that there were multiple errors in both your initial papers. However, the authors were never given the opportunity to respond to the letter of concern because they had not been informed that a retraction process was in place. The 3rd manuscript cannot be taken. as that letter. In addition, the independent reviews were markedly flawed and violated all professional norms and rules of review. All three reviews are nothing more than personal attacks on the authors. The reviewers falsely claimed that the main author is an osteopath, whereas he is a fully trained and registered medical practitioner. The reviewers also claimed that the team did not manage melanoma, which is blatantly false, as most of the authors had been managing melanoma for years. The reviewers claimed that the team had never done drug trials and hence would not know about these. In fact, the team had set up and run drug trials. The reviewers also said that the team did not have the breadth and depth of expertise to cover the topic. How would they know all this? Their ignorance is obvious from the above statements, and they certainly would not know the degree of expertise of the authors. The reviewers wrote that they suspected that the articles contained so many errors that they should be withdrawn. However, they never actually checked for errors. Just suspecting, is this enough to condemn authors? One reviewer could not find some of the authors on Google Scholar. Since when is not knowing an author proof of errors? One reviewer wrote that he or she had a brief look over the material and had not read the articles in full. Well, how can this person be taken seriously, not having read the papers, yet concluding that there must be errors there? There is another puzzling aspect to the three reviews. Reviewer B wrote, as I said before, what followed was actually mentioned by reviewer A and had not been mentioned previously by reviewer B. Are reviewers A and B, in fact, the same person? It is important to note, not one reviewer listed any factual errors. The reviewers made false statements about the authors. One had not even read the papers fully. This leads to the question, where did Professor Margolis find three reviewers who would provide such attacks? And remember that all journal guidelines prohibit ad hominem or personal attacks in reviews. The authors appealed to Cope. However, Cope stated that he does not investigate individual cases. However, they stated that Cope provides general advice to journals on implementing guidelines. They did, however, write to the editor-in-chief to ask what procedure he followed. The editor-in-chief refused to respond to this request for 6 months. However, following 2 terse letters from Cope, he wrote a fictitious account of the procedure that he had followed. Cope responded that although they could not investigate individual cases, based on what he had stated, Cope guidelines were followed. The authors appealed to Dr. Karen Price when she became the new president following the death of Dr. Ness Polon. She wrote to the authors that the journal will relinquish copyright so that the authors would be free to publish elsewhere. This was not honored. The consequences have been tragic. Libelous notices falsely stating that factual errors were made are still up on the internet and on the journal's website, even though the papers themselves have been removed. The authors suspect that this was done to prevent anyone evaluating them and finding that, in fact, there are no errors in the papers. One of the authors was a career researcher in a major university institute. He was almost immediately fired and has not been able to work since. One of the authors was in the process of promotion at a prestigious university, which was cancelled, and he later lost his existing position. All authors have had their reputations destroyed. There is ongoing stress and depression amongst at least some of the authors, knowing that their reputations that they had worked hard for all of their lives had been maliciously destroyed. Apparently, this is not the first time that the MIA team of Thompson et al. Had acted in this way. One of the authors was contacted by another researcher who wrote, "The methods performed by the MIA team are well known. They tried to discredit us when we started the initial Cochrane review, and it was somebody that supported our group working with the evidence in bringing the truth is as suggested by the evidence and not just the other team's truth as suggested by personal wishes." Amazingly, the Melanoma Institute Australia team has started writing as its own opinion the things that they so criticized the authors of the papers of. Professor Richard Scolyer, who you recall was the third name on the letter demanding retraction, in giving the Hunter oration at the Australasian Dermatopathology Society meeting in 2021, stated that there was no difference in outcome with and without sentinel lymph node biopsy. I would like to remind you that in the letter demanding retraction, this procedure was stated as a life-saving one. Professor Scolyer also spoke of high-definition ultrasound, yet the authors were denounced for a similar statement. Subsequently, the authors asked for independent reviews of the papers. One reviewer wrote, "Overall, I felt that the papers were perfectly reasonable and factually accurate, albeit presenting a viewpoint that looked at the SL and the sentinel lymph node biopsy evidence and finds wanting. This is perfectly reasonable and supported by MSAC. The federal government has looked at the evidence," and so on. Another reviewer said, "These two papers are excellently written. The authors are to be congratulated for taking the time and effort to critically appraise a large number of published papers to summarize a result and present them in such a clear manner. It is absolutely stunning that these two papers are retracted at the request of a single person. I do not see any possible reason for retracting those papers. I would rather think that these papers should be disseminated and used to promote the correct use of principles of evidence-based medicine." Another review stated that the authors' concern about SLNB are not alone. Indeed, Professor Thompson's own colleague, Samuel Zagarella and Michael Bigby, the latter Harvard University physician, had written opposing views on this topic. The MSLT trials indicate that there are no overall melanoma-specific survival advantages to performing sentinel lymph node biopsy. The use of sentinel lymph node biopsy status alone to accept and stratify patients for clinical trials or to receive adjuvant treatment is not rational. A significant body of melanoma aspect would confirm that sentinel lymph node biopsy provides no improvement in longevity, and hence its routine use being mandated by surgical oncologists could be considered at the very least self-serving and potentially harmful to those patients who are already dealing with a potentially life-limiting diagnosis. Dixon and Steinman have presented a view that is based on facts and is at odds with Professor Thompson in the British Journal of Dermatology. In summary, the Melanoma Institute, the Australian Journal of General Practice, and the Royal Australasian College of General Practitioners made personal attacks and claims of factual errors in the papers. They, however, refused to state what the factual errors are. Compare this with independent reviewers who could not find any factual errors in the papers. This is the reason that the Melanoma Institute, the journal, and the Racgp refuse to tell the authors what the supposed errors are. In conclusion, it is evident that cancel culture has replaced scientific analysis, reason, and debate. Self-regulation does not work. What does this say about the Melanoma Institute, the journal, and the Racgp? Is this the standard of medicine that we want to continue with? I therefore call for an independent judicial authority with powers to oversee and to which people can appeal decisions by institutions such as the Racgp, and an authority that would have the power to sanction institutions. Thank you for your time.